The cervical screening programme is available in the UK to all women and indeed anyone with a cervix. It's a free screening programme for all those between the ages of 25 and 64. You're not invited under the age of 25, as if there are any changes in cells in the cervix, they tend to right themselves of their own accord, and indeed after the age of 64 statistics show that the problems are very much less significant. A lot of people are nervous about the prospect of coming for a cervical smear. Perhaps they don't know what to expect, or indeed they're even frightened by what it might lead to. So I'm just going to go through really what to expect. You will be invited by your GP practice by letter, usually a reminder to phone the practice to make an appointment. It's likely to be a nurse in the clinic that you will see who will do the smear for you. If there's someone you know who you've seen before, or perhaps has done your smears previously, do ask for them by name if that would help. You'll be invited for an appointment that's somewhere scheduled for something like 20 to 30 minutes, but the actual procedure is about 2 minutes long generally. But that gives you time to get settled into the waiting room and then for the nurse to call you in, do all those normal things like checking your name and your date of birth and your postcode, etc. And then talk you through what's going to happen, ask you if you've got any worries, any particular concerns. They'll want to double check if they don't know already, if you are taking any medication that's hormone related, such as the contraceptive pill, or possibly hormone replacement therapy. They'll want to know the date of your first day of your last period, so you'll get all that sorted out. You can bring a chaperone with you for that matter, somebody suitable over the age of 18. But if you would like to have a chaperone, there will be trained chaperones available in the surgery. Please do ask for one, because it's so important to everyone that you're put at your ease. When you're ready, they will pop you behind a screen. They will tell you to remove the lower half of your garments from the waist down. Although if you've got a skirt, you can keep that on and just simply pull it up. They'll pop you on the couch, and then they will give you a blanket or a sheet or a cotton covering to cover your lower half. So you should expect to feel confident and have your dignity maintained at all times. Again, when you're ready, the nurse will ask you, mostly you would be on your back, pull your knees right up towards you, keep your knees and ankles together and let your knees fall open. Then they will introduce a piece of equipment called a speculum, which is made of plastic. When you're ready, they will insert the speculum. If it's important to you that they warn you when that's going to happen, if you can't see, then do ask them to tell you that. The idea is that they will use the speculum to get a better view in through your vagina to your cervix. They expand the speculum slightly just to make that a little bit easier. Then they'll pop a brush in, they brush it over the cervix to collect some cells. Then they will withdraw that brush, and then swiftly after that they will withdraw the speculum, and then they can be popping that little specimen they've collected into the specimen jar, ready to send it off to the laboratory whilst you're getting yourself dressed. You can sometimes experience what they often call a bit of spotting, which is a tiny bit of breakthrough bleeding. Not always, but don't be alarmed if that happens, because it's very normal. I'm sure they'll warn you about that. But you might want to just take the extra precaution of wearing a panty liner just to make things more comfortable for yourself. The specimen will be sent off to the lab, and I think it's normally around 2 to 3 weeks you'll get the outcome by letter directly to yourself at your home. It will explain to you that hopefully everything was absolutely normal. And depending on your age, you'd be recalled every 3 to 5 years. If you're deemed to be at slightly higher risk because there are some HPV cells, that's the human papillomavirus, which is the thing they're looking to detect. They will either ask you to just come back in 1 year instead, just to keep a closer eye on things. But if there are any cells that are giving any greater cause for concern, then they would arrange to bring you into a more specialist clinic to have another look, consult with you and take it from there. Sometimes people worry that it's going to be painful. It's very different for different people. It can feel momentarily uncomfortable, and one person's discomfort might be someone else's pain, but generally you would expect it to feel no more than just a slight momentary discomfort. Another thing that people worry about when they're being called in for a smear, particularly if they haven't done one before or they've missed them for a while, is do they need to prepare themselves in any particular way? And the answer to that is no. The only preparation they really need is to try to feel as relaxed and as comfortable as possible in what they're wearing. Bear in mind that if it is a skirt, then there will be less undressing to do, but otherwise, no. But I would just remind you, if you have got any particular worries before you come, you can ring the surgery and ask those questions.